Hey everyone, this is Tom Salemi. Welcome back to the Device Talks Weekly Podcast. This week, I'm going to bring you a conversation we had from Device Talks Boston. I'll get into the details later on, but it was a great session put on by Stryker. We talked a lot about digital medtech, about the inclusion of data, and I think we're going to be talking about that a lot. We've got a lot of great episodes coming up, episodes of the podcast. I'll be talking with Fractal. I'll be talking with Moon Surgical. I'll be talking with Boston Scientific. I'll be talking with Cala Health, HeartFlow, many, many more. We've got a great lineup of episodes coming to you over the summer. So make sure you're subscribed and ready to go. Have a cold drink ready by your lounge chair on Friday evenings and enjoy Device Talks Weekly. Next, speaking of wireless medical devices and connectivity, we're going to have a Device Talks Tuesday. This Tuesday brought to you by Intertech on regulatory and cybersecurity requirements for wireless medical devices. Go to devicetalks.com to register for that and our other upcoming Device Talks Tuesdays episode. And finally, of course, registration is open for Device Talks West. That is happening on October 19th and 20th. Got some great keynotes lined up already. I'll be putting together an agenda, have an early agenda up for you in a couple of weeks. But if you'd liked Boston or heard about Boston from some of your colleagues who attended, do not miss out on Device Talks West. It's going to be just as great. So go to devicetalks.com to register for that. Now let's get this episode started. All right, you ready for this?
Ready.
Chris Newmarker, how are you, sir?
Good to be here, Tom. How you doing, man?
I'm doing well. I think I'm ready to fly into the danger zone, Chris. I need me to see that Top Gun movie.
Oh, yeah. No kidding.
Yeah. What do you think? Have you seen it yet?
Haven't seen it yet, but, good reviews. I mean, a lot of sentimentality in it, I hear, but hey, why not,
Yeah, we watched the original with my sons who are 16 and 12, and about every 10 minutes they would just look at us like, really? Like, just watch it. Just watch it. But it doesn't hold up. I mean, for us, because the sentimentality, as you said, nostalgia. But I'm told the new one's a good movie, and we're seeing
when we were on a vacation to LA a few years ago, we saw the Beach House where Tom Cruise, did the.
Really?
Yes.
Wow. Is it blocked off? Is it cordoned off? Is it a museum? A museum of hot guys?
It's just a house in the middle of the Paramount Studios lot.
Oh no!
There wasn't even a beach there. We're just doing the tour of the studio, and they're like, "Oh, and this is the house." Like, I'm like, "Oh, like wow, like yeah." And they put stuff behind it, digital whatever, wizardry or whatever.
Wow. Okay. Well, that's exciting.
Pretty wild. Like,
yeah. I mean,
there's also a parking lot there where Charlton Heston parted the Red Sea. They said that they actually flooded the parking lot in front of him while he was dressed as Moses, and then they just played the film backwards in the movie.
Shut up.
No, that's exactly what they did.
Wow. Well, see, that's kind of cool.
They were flooding a parking lot in front of them. Isn't the movie business great?
That is amazing.
Isn't it?
Let's end the podcast right here.
I shall part the
party. Because there is a Starbucks on the other side, and I really need a latte.
I need my coffee.
I'll have to look more closely if I watch that movie and to see if you can see any parked cars. I assume they emptied the parking lot.
Yeah, there was probably a memo around the studio.
That's right. Do not park.
Parking lot today. We're doing the parting the Red Sea shot.
Amazing. This is just so informative. And I'm also watching you watched the Obi-Wan series on Disney?
I have not yet. I'm kind of getting, it's like, really, is there going to be like a series for every Chewbacca, the real story? Starts out as when he's a little, whatever they were, a Wookiee cub. It was
I guess probably a cub. I would go with cub. Yeah.
Cub.
Chewbacca would actually be a pretty good series. Yeah, Obi-Wan is fine.
What sound would his dad have made? Like, pulls up the.
I think you need to stop doing that. You're breaking the Zoom lines.
Sorry.
No Wookiee sounds on the podcast. So so Obi-Wan is. I hear you. I'm as I'm talking, I'm realizing I'm living a lot of my life in nostalgia zone. But Obi-Wan's worth streaming someday if you got a rainy afternoon for sure. All right. Well,
anyway,
let's fast forward to the year 2022.
Yes. Do we have to?
Yeah.
Can we just stay back?
We will definitely skip over 2020 and 2021 because those weren't very good. But 2022,
forget those years.
Yeah.
Here we are, 2022.
Specifically, the week of whatever we're at, the day of June 10th, 2022. Let's see what the Newmarker's Newsmakers were for that.
Here we go.
Time.
Yeah, star date. I don't know. Anyway, yes. So number 5 on the Newmarker's Newsmakers is that Smith and Nephew. They've had a R&D location in the British city of Hull for over 100 years, and they actually started in Hull in 1856.
Wow.
But they are going to be moving outside of the city 8 miles, building a new R&D and manufacturing facility that's expanded 8 miles away at the Milton West Business Park. More than $100 million project. UK government supporting it. They just basically couldn't find any. They said they couldn't find any place inside Hull that was large enough for what their needs were. So, I mean, it definitely seems like a good win for the United Kingdom. That this really important medical device companies of theirs is going to be keeping all these operations, all these hundreds of jobs in that region. But just kind of an interesting thing that Smith and Nephew is very closely tied with the city of Hull, and they won't be inside that city now.
Okay. All right. Well, not too far a move, and I'm looking at the very kind of you to put a image of the UK with the article, and I see Hull is roughly the same longitude or latitude. Anyway, just east of Manchester and
there you go.
Liverpool, so it's up in the middle part of the Isle.
Yeah, exactly, kind of the middle part of the Isle. Kind of on the other side from Liverpool. So it's just like a really I think I was reading one article saying like when you're heading into Hull, you can see the big Smith and Nephew sign. So it's definitely part of the community. Kind of reminds me of how the stories around here. Like 3M decided a while back they had to move out of St. Paul and they headed out to Maplewood, so they could get more space.
Mm-hmm.
It's kind of feels like that same. We still associate 3M with St. Paul. I'm sure you'll still, Smith and Nephew still going to have a connection with the city of Hull, but they're just not inside it anymore.
Well, moving is never easy. So if anyone has boxes, Smith and Nephew may be looking for boxes.
Yeah, send them some cardboard boxes or.
Let's take a minute to bring in our episode sponsor, Flexan. Flexan is a global contract manufacturer and assembler. I had the opportunity to speak with Mike Hures. Mike is Vice President of Sales and Marketing at Flexan. In our conversation, Mike told me how Flexan has been working with OEM. Specifically, we talked a bit about Flexecution. Let's listen.
And it really is, 3 elements of our business. The first is design, develop, and deliver. The design portion is, from a commercial perspective, we're picking the right partners where there's a strong need for our services. And it's really important upfront to align those needs with our capabilities and most importantly, our experiences. And once we engage with customers, we understand what their manufacturing needs, whether it's new product development or it's a manufacturing transfer. And that allows us to then get the rest of the organization and do a comprehensive overview of what that solution would look like. And especially in today's environment, given the stringent quality requirements, especially if you're dealing with a class 3 implantable component, as well as the ever-changing environment within the regulatory space. So having that upfront engagement and really understanding the needs before you even get to the economics is absolutely critical. And if you do that really well and you build those experiences and you build that working relationship, because it is a working relationship as an extension of their organization, we found that to be really the recipe for success with us. Obviously, great communication, achieving timelines, achieving cost targets, and making sure, that service aspect of it is really addressed. That makes for a really fruitful relationship because they're counting on us. Our customers are counting on us to really be an extension of their organization, as I mentioned, but to really deliver. And so if we do that well, there's certainly more opportunity to grow within that relationship. And that's really been a successful model for us.
Excellent. Thanks, Mike Curis, for joining us on the podcast. And thank you, Flexant, for sponsoring this episode of the Device Talks Weekly podcast. If you want more information about Flexan, go to flexan.com. That's FLEXAN.com. Let us roll on to number 4, to Chris's new obsession, GE Healthcare.
Man, GE Healthcare is, a lot of news, and, they're, including like they're, doing a lot of stuff with Medtronic now. So, but their latest news, which, got some attention on Mass Device for sure, was that they've got a new intelligent Shelly sells seashells, new intelligent workload management.
I am worklord. Sorry, go ahead.
Worklord. They have the worklord for a new workload management solution for radiologists. The new software platform for its PACS solutions, integrated with QIT's Helix Radiology Performance Suite. So they just unveiled this at the Society for Imaging Informatics and Medicine. But it operates on predictive analytics, optimizes radiologists' workflow across the entire enterprise. The idea is like to get more efficiency, more productivity. We're seeing a lot of these types of products, like trying to make healthcare more efficient. And talking about that, it's not on the Newsmakers this week, but Oracle. Some interesting news out of Oracle as they're closing this multi-billion-dollar acquisition of Cerner. They're really heading into the electronic record space.
Absolutely, and you sat in on the call yesterday, right? Any quick takeaways?
Yeah, I sat in a little bit on their call. Caught the beginning of it. I mean, they had Larry Ellison, talking about really ambitious plans with it. I mean, he wants to. I mean, it's a huge problem in the U.S. The fact that I've got my primary care doctor and the health system I interact with a lot, and they've got all my records, and they could say if as long as I stick to that hospital system, they know what I'm all about. But if they wheel me into another system, for whatever reason, they really don't know much about me, and it's kind of wild when you have to go into a different hospital and they're asking you just like a bazillion questions, when you're in a health emergency. And Ellison's like, hey, I think we're going to create a national electronic health record for everybody, where basically, your health record gets automatically uploaded whenever you interact with a health provider to a national system. And, it's not like every health provider can just access it automatically, but you go in somewhere else, if you give them permission, they can access all your records, and so that's his goal. There are, different big companies that provide different EMRs across the country. So it sounds to me like it's going to be a huge challenge for them to, do this. I mean, he bought Cerner, their big one, but I mean, you go over to Wisconsin next door, you got Epic.
Yeah, Cerner's been going through an interesting time, and I actually decided to bring in an expert. So I did connect with Keith Figlioli. He is a general partner at a venture firm called LRV Health, and Keith has spent his career in the healthcare sort of payer information side. So he brings an interesting perspective and understanding of this space. So let's listen to this interview I did with Keith Figlioli, who is also the host of a podcast that I helped start a couple of years ago. So
nice.
All right, well, I'm here with Keith Figlioli of LRV Health. Keith, thanks for joining us today to talk about this big deal.
Absolutely. I like this. I'm coming on your podcast now.
I know. Keith and Keith started his Healthcare is Hard, a podcast for insiders many years ago now, and still happy to contribute to that one. But happy to have you here at my house. And before we get into the Cerner Oracle deal, because I need a better understanding of that, tell folks a little bit about LRV Health. What do you do there?
Sure. LRV Health is a sort of, think of it as, exclusively focused on healthcare and exclusively focused on working with the incumbents to think about disruption and allocating capital into the venture markets on their behalf. And so we have 24 different strategic partners that cover about 200 million Americans around the country that either are part of payers or part of actually health systems where they get their care that also are our strategic partners. And so we've been doing this since 2000. We've done about 60 plus investments in sort of disruptive companies that are helping sort of fundamentally change the ecosystem and move to sort of the next place in terms of overall healthcare transformation. And
you folks invest both in digital health and healthcare startups, but also in medtech as well.
We do. So we do a little bit of the majority of where we invest is sort of what we call tech-enabled services. We do a little bit of healthcare IT only. And then we also do a little bit of device and diagnostics, which, to your point, medtech.
Mm-hmm. Great. And for the last bit of context, you came into this or come into this conversation with the background with Premier. You were in Premier for a time, but how would you classify the time spent in your career on the payer side, on the supplier side?
Yeah, I would say a little bit of everything in the ecosystem, but most of my operating executive roles over the last 2 decades has been at very large companies. So to your point, Premier was one of the executives there for a long time. So it's kind of in the middle of kind of health systems, the government, and the suppliers, obviously a lot of med tech and other players like that. And then before that was in the electronic health record space. And so spent a lot of time with Eclipsys before that ended up getting transacted to Allscripts back a bit ago.
Great. So now we know where you're coming from and the background you bring, which is why I reached out to you to kind of help us understand what the Cerner Oracle or Oracle's acquisition of Cerner means. So what does this deal provide for Oracle?
Yeah, I think on the face of it, there's been a lot of, as you know, there's a lot of general press, tech press because it's Oracle, and there's a lot of healthcare IT press because it's Cerner. Mm-hmm. I think on the face of it, since Neil, the founder of Cerner, one of the founders of Cerner has died, Cerner has been sort of working through sort of a broader strategy outside of not just competing head to head with Epic, but also thinking about different vectors of growth. And they've spent a lot of time recently, putting together what I think is a pretty comprehensive strategy around sort of RWE, real world evidence, working with medtech, but also working with other, biotech and pharma players. And they've created a new brand called Cerner and Visa that sort of culminates a lot of that work. I actually think this hasn't been talked about a lot in the press, but I think it's one of the big gems, growing gems from a high growth standpoint that Cerner was highly attracted to. Oracle was highly attracted to it. I think why Oracle was highly attracted to it is if you get underneath Oracle's healthcare business, their industry vertical in healthcare historically, the majority of their dominance has been in the life science sector. They do, a little bit in sort of what I call traditional health system and traditional payer. But my understanding is, and this is a little bit dated maybe, but that they have a lot of sort of iron, if you will, their iron and their cloud sort of really deep in the life science sector. So I think that's an interesting kind of play that people probably are not talking about. On the base Cerner business, I think the other thing Cerner's done an incredible job on is they've created a very highly profitable, very accretive core business in their clinical and software business. Mm-hmm. And I think that helps the bottom line of Cerner. So like one of the headlines on the closing of this week was how accretive. So both Larry, the CEO of Oracle, and the head of industries, the EVP of industries at Cerner, I saw quoted saying how highly accretive Cerner is going to be to Oracle. So I think it's probably that combo play if I'm a corporate executive at Oracle thinking, hey, I can have a really accretive acquisition on the bottom line because they have a stable core base of business. And then I have potentially a high growth business tied in with our pharma and medtech business in terms of what we're trying to do there.
Mm-hmm. So what does this mean for Cerner going forward? There's Cerner, there's Epic. Those have really been the two big players. Does this change this rankings at all? Does this give Cerner the ammunition it needs to make a run? How does this change the landscape over the next couple of years?
Yeah, I don't know if it changes that much. I think first question is how do these businesses get integrated, right? The other big acquisition, big number acquisition, this is now the largest takeout of a pure healthcare player. Before that was Microsoft's acquisition of Nuance. Mm-hmm. And so that Nuance team now is taking on and staying whole and owning the entire Microsoft healthcare strategy, from what I understand. So I think the same thing could happen here. You have David Feinberg, who was an insider CEO of Geisinger for a while and then went over at Google after that. But he could end up getting the reins of a good portion of the entire healthcare vertical for Oracle. Because what the big tech folks have realized, because they've tried this a couple of times, is you need insiders. You need people who really understand the space to drive the right types of strategies and to gain the trust of the various providers and payers that are in the market. So I think it'll be interesting. I think it's too early yet. I don't know yet, how they're going to fully think about integrating it in David's role and the rest of the team's role. But it may be more of the same. I think, one side piece on this, just going head to head with Epic, this might be more fodder for Epic, right? As a big tech player comes in, they get tied up in integration. Mm-hmm. Epic has been on a roll, taking out Cerner sites in the market on the provider side, pretty consistently at the top end of the market. I think Cerner has held their own in the middle of the market. But almost every major academic center, almost every major, large IDN, with the exception of a very few, are either running Epic or have decided to transition. There was a big holdout in Florida, Advent Health. It was a huge Cerner co-development shop. And over the last year and a half, they made the decision to swap over to Epic.
So as data becomes more important for the medtech companies, will this impact medical device companies at all who are trying to acquire data wherever they can to make their devices perform better than they have been, or to create new devices that do an even better job?
Yeah, I think people are now going to have a pretty big footprint on the medtech side to potentially go talk with people like Cerner and their unit, their Envisa unit in this space, to sort of think about that extraction. 5 years ago, this wasn't even an option for people. Mm-hmm. And now it's a pretty big option for people to be thinking about that type of stuff. So I think you'll start seeing more strategic relationships even be struck between kind of, what is the Cerner Oracle side and a lot of large med tech companies.
Excellent. Anything I'm missing here? My head's spinning a bit from all this data talk, and it's all this stuff that sort of happens in a world that I'm not quite familiar with. So any important elements that we should know about going forward, or anything about this deal that's going to create some good or bad?
No, I just think it's like, it's always about intent, and what are these huge, technology conglomerates really, really want to do in healthcare. It either really, really works or it doesn't. Mm-hmm. And I think it's way too early to tell to see how this stuff plays out. Even for Microsoft and Nuance, Nuance has got a dominant, almost a monopoly in voice enablement of healthcare. And, part of the Oracle stack right now is they've got a lot of voice stuff, emerging voice stuff as well. And so you got a lot of these vectors that are the same at all these big tech players. And it's like, who's going to dominate what area once these things get gobbled up by some of the big tech players? I think it's still TBD. And you still have Amazon and you still have Google out there too, that kind of had played. Google went to where they should have gone, right? They went and bought Fitbit, and they played much more on the consumer side of the equation, but they're doing a lot of enterprise healthcare stuff now. So It's just an interesting kind of like, if you think about the software side of clinical delivery and other things like that, it's becoming more of a utility. And the utility is then being powered by the biggest tech players in the world.
Well, it's great to finally have you on my podcast, Keith. Thanks for joining us.
All right. Thanks, Tom.
And we're back. All right, Chris, let's roll into number 3 on the Newmarker's Newsmakers.
Number 3 on the list, we had, Johnson & Johnson's Ethicon launching their next-gen surgical stapler, the Echelon 3000. And this is, it's digitally enabled, and it's supposed to provide surgeons with a simple one-handed powered articulation. It really sounded like a lot of the descriptions of this next-gen surgical staplers is just providing greater jaw aperture, more articulation, really helping, surgeons basically just, get in there better and get the job done and get done more, accurately and efficiently. This story, it's interesting. it surprised me that it got hundreds of views on Mass Device this week. But at the same time, I think it's just a good reminder that, we talk about some of these technologies that sound really robots,
right? Renal denervation and all
renal
that.
denervation, but you know what? A better surgical stapler is that can make a difference.
That can make a difference every single day. And I know you reached out, you tried to connect with Tom O'Brien, the worldwide president of Endomechanical at Ethicon. He was not available this week, but
sounds like they're interested in him talking, to us, in the next week or two. So hopefully we can get an interview going, because I definitely would like to hear more, from him about, how this, basically hopefully save more lives, reduce complications, just make things better.
We'll work to get that on a future episode. Brought to you by Worklord Chris Newmarker.
Worklord.
This is a new nickname.
We do work at a company where, the initials stand for willing to work hard.
That's right. That's right.
I will take that. I am a worklord. Do I get do I get knighted? Is there some ceremony becoming the worklord?
We will give you a black cape and helmet that
an helmet
amplifies your breathing.
Wow, that sounds like
the worklord of Sith. Where is my article?
As long as I don't have to go through what he went through to get there.
We won't set you on fire.
No. Yes, Tom, please don't set me on fire.
What is number 2 on the Newsmakers?
Moving on. Oh goodness! This was kind of interesting too. That it got a lot of attention on Mass Device again. So I mean, it's amazing. I've been here. I've been in charge of medical design outsourcing for 6 years. I've been here really paying attention to Mass Device as executive editor for now almost 3 years. Wild, time flies by. But I still get surprised by what interests our audience, which I think is great. I'm still learning. But this article, this was Medtronic announcing a new chief medical officer for the neuromodulation unit. And actually, this makes sense because, neuromodulation is just such a hot space. We've just seen this trend over the last decade of, taking the technology that we have with pacemakers and applying it to other parts of the body, to the nervous system and the brain. And they're bringing in Dr. Ashwani Sharan as their chief medical officer. And he before joining the company, he was president of the Congress of Neurological Surgeons and the North American Neuromodulation Society. So I suspect he knows a lot about neuromodulation.
I'm guessing
he's running the society for it.
I'm guessing he brings a pretty healthy Rolodex and understanding of the space. Yeah.
So I think he looks like a very prestigious hire. So it's good for Medtronic.
And we'll be talking about Medtronic's Neuromod and Boston Scientific potentially too at Device Talks West. So Brett Wall, who's the head of that group, will be there giving a presentation. So excited to have it covered at Device Talks West, and I'm glad this news is getting attention. So neuromodulation is a fascinating space, and it's only going to get more and more interesting.
I suspect we'll have Dr. Sharan on a future, Device Talks Weekly or a Medtronic Talk. So very cool.
From your lips, my friend. Yes. Let's see if that happens. All right, number one is a cool one. Let's roll into number 1.
Yeah, number 1 on the list. We've got we've got a new up and coming player here in the robotic surgery space. It's Moon Surgical. Based out of Paris and San Francisco. They announced over the past week that they've raised over $31 million, getting money from HT Healthcare Capital Partners and participation from Johnson & Johnson Innovation, and some other, medtech leaders throwing in, some funding into the company. They've got, they're developing their Maestro here. Their Maestro robotic surgery system.
I did talk with Steve Osterly, formerly of Medtronic, for a podcast episode in a couple of weeks.
Advisor to the company, yeah.
Advisor to the company and to one of the investors, Cathay Health, a venture firm,
and another advisor who definitely got my attention, Dr. Fred Moll.
Dr. Fred Moll, he is very interested in this technology as well. And as Steve Osterly described it to me, it's really a system that if you're performing a procedure where you need to have a device or a tool held in a certain way while it's in the body, up the way it's done now is you have a resident with you or an assistant or a nurse hold it in place while the surgeon's working. This will be a system that'll be hanging overhead, and it'll have certain haptic and memory placement technology, and that's my term, not his, but it can hold something in place.
Wow, that's great.
So a surgeon can do their job, and the surgeon can move it easily on their own. So it's really going to be having, like, rather than a robotic surgeon, it's like more having a robotic resident, like someone in, like a helper in place. So it can save on manpower. It can make surgeries easier and quicker. So he's very, very excited about this technology. So we will have Steve Osterly on a future podcast, as well as Anne Ozdue, the CEO of Moon Surgical. I'm going to talk to her next week. Yeah, so it should be interesting. That comes from she was a partner at Sofanova's MedTech Accelerator, MD Start, and now she is CEO of the company. So
wow, that's
exciting
great
stuff.
People, I tell you, and they're coming on the show. I say this is the place to be. You're not cool if you're not coming on here.
Hi, everyone. Tom here. As sure I've told you in the past, at Device Talks Boston, we invited several larger OEMs to give presentations and panels, and it was very successful. We'll be doing the same thing at Device Talks West. The panel that ended day one in Boston was by Stryker, and it's called "With New Tools, Technologies, and Strategies, Stryker is Advancing Digital Healthcare." I wanted to share the audio from that presentation. The conversation was led by Spencer Stiles, who's Group President, Orthopedics and Spine at Stryker. It included Sid Satish, the Vice President of Digital Innovation for Surgical Technologies, formerly of Gauss, which was acquired by Stryker. Dave Lively, who is now a Senior Vice President of Product Management, formerly of Vocera, which is now part of Stryker. Robert Cohen, President of Digital Robotics and Enabling Technologies at Stryker, and Tracy Robertson, who is Vice President of Digital at Stryker. We're going to run through sort of the opening questions of the panel, and I will sort of take a break in between each to introduce the speaker so you can understand, just recognize voices and know who's talking. And then toward the end, we'll just sort of let the rest of the discussion play. It was a really great conversation about where Stryker's headed, about the inclusion of data and tech into medtech, about the challenges that the challenges that arise. And it was a very good conversation, which of course is why I'm sharing with you. And some good conversations or good points made later on about bringing disruptive technologies to large organizations. So this first segment is Spencer Stiles, and again, he's Group President, and he'll just talk, give a little bit of intro of how Stryker is looking at data and medtech.
A little bit about our operating model. We've historically been a fiercely decentralized organization. I ran into a few Stryker alumni in the audience here. They remember this. We wake up totally focused around a specialized care provider. And that has served us very well for decades and decades. However, as the world has evolved and changed, now technology is shifting how we think about this. It's a common language that holds across all these specialties is data, is the way a customer interfaces with our technology. So how do we create an environment and a user experience that's similar? And we really even think about it as a language. You know, we speak all different languages at Stryker, but digital is an agnostic common language across the world. The ones and zeros show up in China as they do right here in Boston. And so thinking about how to service that is really important to us. Maybe one of the big steps we've more recently taken is centralize some of the technology in our company and leadership under an entity we call DRE, Digital Robotics and Enabling Technology, where we have leadership positions. Leadership in hard tissue robotics with our flagship product, Mako, a lot of the enabling technologies with tracking, guidance, imaging, navigation, and really on the front side of digital, collecting information, putting in a cloud, making sense of it, creating value back to our customers, and you'll hear about that today. So with a little context of our expertise, and again, a long way to go, I thought I'd turn over to some of the exciting questions we have lined up for our panelists today. So.
Our first speaker is Tracy Robertson. Again, she's Vice President of Digital at Stryker. Interesting. She joined the company last year. She previously had been at Kimberly-Clark. Before that, she was at GE. So she's coming into MedTech with a fresh perspective. In this clip, and you'll hear Spencer Stiles ask the question, he opened up asking the panelists what compelling trends they're seeing in technology. So let's hear from Tracy Robertson, Vice President of Digital at Stryker.
I think the one that I think about the most is in the area of product security and privacy. And I'm sure many of you are probably in the same boat. As we continue to evolve and expand our digital offerings, our ecosystem of customers is expanding. We're spending more time with IT, legal, C-suite, security, and one of their top concerns is product security and privacy. Unfortunately, healthcare is plagued with constant cyber attacks and ransomware attacks, and it is not slowing down. And more than any other industry, they are at the top. And one of the reasons for that is, private patient data is worth a lot of money, more so than other data, private data such as social security or credit card data. So what we're going to see there is, and we already are, is a lot more government regulations, which is really going to fundamentally change how we operate and design products through product lifecycle development. Probably more customer scrutiny, we're already seeing that, and maybe more hesitancy in data sharing and connectivity in the network. And so, as medtech providers, I think we have a huge responsibility to do everything we can to protect our devices and the data that customers share with us. That's a big responsibility, and we take that very, very, very seriously. So this is one that is constantly evolving, and I think is not going to slow down.
All right, our next speaker is Robert Cohen, President of Digital Robotics and Enabling Technologies at Stryker. He was actually part of Mako when Stryker acquired it back in 2014. So he joined Stryker at that time, and he is clearly excited about what's coming next in technology, in robotics. So let's hear from Robert Cohen, President of Digital Robotics and Enabling Technologies at Stryker.
Well, I'll tell you, it's a changing world. When you do this for as long, I've come from Mako Surgical, I've worked in total joints, implants, things like that, spine, sports med, and lots of different places. I can tell you, this is the most exciting time. And if you're in the world of technology and innovation, even though it's complex, it's exciting. And why? You look at some of the disruption in the marketplace, and you look at where these disruptors are coming from. The disruptors are coming from not necessarily medtech. They're coming from many, many different places, and we have to pay attention to that. And while we pay attention to that, as Stryker, it's no longer just a metal and plastic in a box type company. What we do is we have to look now for what's meaningful beyond that. You don't minimize that, but now all the added parts. So for instance, improved outcomes. Now, industry is asked to contribute with data to help a physician, maybe personalized medicine for a specific patient, to understand what to do with an implant, where to put an implant. What about quality of care? Quality dashboards now. What about safety, patient safety, fall detection, all those kind of things. Those are in the procedures that Stryker actually participates in. And then we can get into economics, we can get into hospital efficiency, we can get into inventory efficiency, and it's remarkable. Just think of the four big companies right now that you would not necessarily have thought would be influencing us in medtech. Look at Alphabet and Google and all that they're doing with electronic health records. Look at how interoperability and things like that is now partially solved, but electronic health records can now be put into databases and be queried. Look at what Amazon's doing. Everyone here should think that Amazon is going to disrupt the supply chain and distribution models. That may actually help us from an inventory management perspective. Look at what Apple's done with an iPhone and wearables. Data that we did not have to define ourselves, but data that we have access to, now we can incorporate into the big picture. Look at things like Microsoft Cloud Services. Now hospitals have access to cloud services and people to help them understand it. And then you have the small companies. Look at some of the small company disruptors. Think of these small companies. Just focus on diagnostics for a second. It's remarkable what some of these small companies have done with ultrasound imaging, MRI, CT scans, and the insights they've gotten with artificial intelligence. So companies like Stryker, doesn't matter how you're around for 80 years, if you're slow, you're going to lose. You have to look at product development in completely different ways. You cannot have this waterfall effect of development that we're typically used to for decades old in this industry. We as an industry have to look at partnerships with hospitals differently, partnerships with digital companies differently. You don't have to do it all inside. The secret formula is how to figure out which companies to partner with, what to go after first, and agility is an absolute must. We need to accelerate and we need to move fast, and we formed within Stryker ways to do that.
All right, the next speaker I would like to introduce is Sid Satish. He is Vice President of Digital Innovation for Stryker Technologies. Sid was a co-founder of a company called Gauss that he'll describe a little bit later. Stryker just acquired that last year, and it adds a real new element to its digital surgery strategy. So in this first clip, Sid will tackle the important issues he's seeing in the technology industry.
I'd say one of the big technologies that obviously brought me to Stryker and my company Gauss was computer vision and the associated technologies of machine learning, deep learning, so-called AI. And what's kind of interesting being at a much larger company now is that we just went from having what I call like an edge sensor. We had iPhones and iPads at Gauss. They're just data collection tools that are made by Apple, and then there's Apple. And what's kind of exciting about being at a big company is now you have access to 80, 90 devices that all are collecting very interesting types of data. There's many, many cameras and other visual sources of data. And there's now processing at the edge. So on-premise processing, you don't have to rely on the cloud per se to run these powerful algorithms or to train these algorithms. So what we're really excited about as a new class of technology is as you start to connect these multiple devices across the continuum of care, and you can start to mine those data feeds that are coming off those devices. Processing is now possible to the point where you can deploy these computer vision and machine learning algorithms in very different ways, and there really will be a little bit of AI almost in every part of our business. And we were on a panel this morning with a few excellent innovators. I think every single one of these companies is doing some sort of visualization or algorithmic processing with images and video. You're even starting to see multimodal algorithms, something where you're learning not just from video, but also from sound and from other signals that we're capturing off of these systems. So my bet is that AI is going to be a foundational piece of technology in medicine for the next several decades. It's just going to take over more and more and more, initially as clinical decision support, but ultimately you're going to start to see parts of these procedures be automated in ways that truly reduce variability, improve outcomes, reduce costs. And companies like Stryker really are leading the way because we have so many of these interesting data streams to work from. And the more data you have with the more specific clinical use cases and really an insane customer focus, you can start to really develop those individual applications with AI that sort of move the needle. So that's kind of why I'm excited about Stryker in particular, but also what I believe is one of the bigger trends.
And just a quick follow-up. Spencer Stiles asks Sid to give a little bit of history of Gauss. So we'll hear about how Gauss came together.
So originally, this is, look, I'm an engineer by training. I was, I think, 23 years old. I happened to be able to watch some surgeries in grad school. And I was following these surgeons around, and I got to see surgical bleeding for the very first time. So after passing out a couple of times, and then I sort of came back in and said, okay, let's do this. We realized that there was a very big need. We have surgical robotics, we have all this advanced stuff in the OR today, but we're still doing things around that operating room that are very archaic. We are estimating how much blood a patient loses. And that's been the standard of care since really the dawn of medicine. I know there's some surgeons in the audience. So we developed a computer vision machine learning technology. Essentially, we take scans of surgical sponges and canisters intraoperatively, and we have a pipeline of algorithms that under a second onboard that iOS device, it's an iPhone or an iPad, we can assess the hemoglobin that patient's lost. And to round a long story short, we thought it would take 6 months, quick and easy, 510K. It ended up being 7 years, 7 FDA clearances, a 3-year-long de novo approval, 30 papers backing the technology and its validity. And we were able to scale it into really a business where we are selling software as a service that uses AI to help avert these hemorrhages, to recognize hemorrhage faster or recognize the need for a transfusion.
Yeah, it's incredible technology, and more importantly, the impact it's having on saving lives, especially in childbirth, is so important to our mission. So thanks, Sid, for all your leadership and impact.
All right, this will be my last intrusion. I'd like to introduce Dave Lively. He is Senior Vice President of Product Management at Vocera, previously at Vocera. Now it's part of Stryker. Huge acquisition that we had featured on the Stryker Talks podcast a bit ago. In this clip, Dave will pick up on Spencer's opening question about interesting trends in technology, and then we're just going to bleed right into the conversation. Now that you know all the players, you don't need to have me continuing to interrupt. So let's hear from Dave Lively, Senior Vice President of Product Management at Vocera, and then we'll hear the rest of the Stryker panel.
Dave, how about in your world? A little bit on the tech trends. Also, maybe show off. He's wearing a pair of collector's items. I don't know if any of you notice his socks, but those say Vocera. So those are collector's items now after we acquire a company.
Yeah. First, Sid said something that was new to me, which is a fast and easy FDA 510K clearance. I don't think I've ever heard that one before, so I'm going to have to keep that one in mind and learn how that one is fast and easy. But I want to keep building a little bit more on what he said, which is increasingly every device and system in the hospital and healthcare in general is getting smart and getting connected. They're all gathering some form of data, and they're all sending that data to someone. And presumably it's someone on the care team that ultimately needs that. You don't need a smart connected device just to sit there and gather data and do nothing. That data needs to get to someone. And as that data increasingly goes somewhere, it needs to get to typically one of the nurses. I mean, it used to be in a hospital room that the nurse would walk into a room and the nurse would notice that something was off with the patient or different, and the nurse would kick off a particular workflow, whether it was getting other members of the care team involved or taking vitals and taking measurements. Today, technology is doing that. The bed can sense if the center of gravity is off and you might be about to get out of bed and you're a high fall risk patient. The bed will know if you're at risk of getting pressure injuries because you haven't been turned or rotated for so long. The patient monitors can detect instantly a drop in vitals. Multiple systems pulled together can detect when there might be an increased risk of sepsis. And so all of this is now being generated by increasingly smart and connected devices. But again, all needs to go back to somebody. And the last thing that we can afford to do, especially today, with staff shortages as they are, is bombard the nurse with all of this at once. Because cognitive overload is a huge thing. And this is where we're starting to leverage machine learning and AI, not from a computer vision, let's look at something, but from a how do I look at these patterns that are going off right now? How do I detect if one particular nurse might be in a flood state because he's getting interrupted by too many things all at once and might be missing something? How do we help spread that load and bring in other people from the care team? How do we help capture that data for later to be able to analyze? How do we help us spot these trends, these patterns that ultimately improve the patient outcome? But they do that by making life better for the care team, by making life better for the nurse. Because if you can reduce the cognitive load on that nurse, ultimately they get to spend more time with their patients being better outcomes for the patients.
Outstanding, Dave. And maybe at a high level, just a remark on Vocera and the core technology set, which you somewhat explained, but maybe a use case.
Yeah, there's a couple of key ones. The one that I kind of talked about is, think of it as a giant rules engine where you've got all this data coming in from all these systems. And we'll take a look at this data. If this patient alarm comes in, then figure out who to send it to. Maybe the role that I need to send it to is the primary nurse. But if the primary nurse is in do not disturb because maybe she's giving medication to another patient, again, you don't want to bombard that nurse with an alarm while she's in the middle of doing something that can't be interrupted, then we'll automatically escalate it to somebody else. Or if it's a bed exit and we're integrated with a real-time location system in the hospital, then we don't need to send it to every nurse on the floor. We can send it to just those that are closest on the floor. So again, reduce the burden on the people who can't act on it in the moment and make sure it gets to the people who can. So that's sort of one key piece. And the other key piece, I'll actually talk about in one of my, maybe later a little bit, which is some of the voice recognition. So I don't want to monopolize that.
No, that's good. The audience is waiting now for your big reveal on voice annotation and some of the work you have. So all of you have been part of breakthrough technology and really where it's disrupted a market. You talked about disruption, Robert. Maybe I'll start with Robert and Sid if there's other remarks to share. But Robert, maybe talk to us a little bit about how you've seen this and even your vision for the future as you think about, breakthrough technologies.
Yeah, it's an interesting question because of where we are in a point of time. For those of you that are familiar with the implant space, whether spinal implants, trauma plates, whether soft tissue anchors, rotator cuff, shoulders, there's so many different things. The next remarkable improvement is going to be getting closer to personalized medicine, individualized medicine. And it's not necessarily about the implant design as much as it is what implant goes in a specific patient, and then where does that implant go in that specific patient to give that patient back mobility, if it's a joint replacement, and quality of life. And when you look at a lot of these technologies that get into this individualized medicine, the one that's probably made the most remarkable headlines in the last 5 years is robotics, soft tissue and hard tissue robotics. But as we focus on hard tissue robotics, it's very different from soft tissue robotics. Robotics has transformed an industry in the shortest amount of time that I can recall. And in fact, robotics has transformed so much. We're sitting here today and we have seen improved outcomes, measurable improved outcomes. We have seen cost benefit. We have seen patient satisfaction increases in registries around the world, and that's due to technology. But the technology by itself in a robot, as I often say, Stryker, we're not a robotic company. The robot's actually the instrument, if you will. It's part of the procedure. We're still an implant company. But now that robot only works with information, digital healthcare data, planning, and other things that feed that robot. So the purpose of the robot is to give you more accuracy and precision for an individual patient and to be able to execute a target, make healthcare safer, make it more consistent. Now, all robots are not the same, and we could have a long discussion on that, but let's just assume Mako's at the top of the house. And if you look
Those are fighting words, Robert. There's a whole floor filled with robots down there. You may want to check out.
Okay, Mako robot is still at top of the house, regardless. So if you take a look at it, think of the data, think of now the operative procedure. You're starting off with a patient's CT scan, digital data. You're segmenting down the three-dimensional model accurately, three-dimensional data. You're taking virtual computer models of Stryker implants and superimposing that on that individual's bones to restore their anatomy, get accurate placement to restore their joint line, to allow mobility. Now you have a digital plan potentially weeks before surgery. Now that's an individualized plan. That plan gets loaded then on the enabling technology, the robot that's in the operating room, and a surgeon then can fine-tune that plan while assessing the motion of the patient and can then lock in that plan, and then with accuracy and precision, the robot guides the cuts to not only execute what's needed to receive the implant, but also provide haptic boundaries for soft tissue protection. So the robot itself takes the digital plan and executes the digital plan, robotic-assisted surgery, and provides soft tissue safety with haptic boundaries so cutting instruments can't nick arteries, nerves, and muscles, and a patient feels better. You should think of that robot, though, as a digital powerhouse. The amount of data it could collect, think about this, time of the procedure. On that specific patient, where did you start off with the plan and where did you finalize the plan and why? And then the robot can port out the final three-dimensional placement of the implant, not 2D films where you have to guess. Three-dimensional models of the final placement. What's that going to do for us? It's going to feed our data machine learning, and artificial intelligence to get us into automated planning for that patient based on comorbidities, anatomic, extent of the arthritic condition. These are all fascinating things. So now you keep the digital power and the capability, but we need a device to be able to execute that plan. It's the combination of the two that we believe will improve outcomes.
Great. Thanks, Robert. Exciting stuff for the world of orthopedics. Sid, how about your world? Breakthrough technologies.
No, it's fascinating hearing Robert talk about robotics, because I like to think of it as a model for other areas, outside of orthopedics. So from our world, let's talk about blood management and hemorrhage. It's ultimately the AI is really cool, right? The digital, the edge sensor, the iPhone, it's really great. But ultimately, I think what gets unlocked is the synchronization of care when you take this kind of technology and you implement it within a protocol within a health system. And related to that, what we're excited about is the synergies that we're getting just by being a part of a larger set of devices. So here's the idea, right? Women in childbirth are bleeding copious amounts. Hemorrhage is a major patient safety in the U.S. And the maternal mortality rates in the U.S. have risen. And this is really a public health issue. So although we started in blood management with the Gauss technology, where we really found significant immediate need was in maternal health. And so by accurately assessing bleeding in real time, we're able to now recognize hemorrhages more accurately and more quickly so that we can intervene with established protocols that we've had since the dawn of medicine to treat bleeding. We just need to know when to activate those protocols. But what's interesting is now we're taking this device, we're pairing it up with these other products in our portfolio at Stryker ST. We have the SurgiCount system, which is a safety system to ensure that we don't leave sponges behind in patients. We have the Neptune system, which is really a powerhouse in and of itself. It's a blood evacuation and smoke evacuation system that's being used in a lot of these procedures. So when you start pairing these devices together and you start getting them to talk to each other, a ton of value starts to be unlocked. It fits more easily in the workflow. These devices can now communicate and share data amongst each other. You can pull data off of multiple devices, send them to the cloud. Like Robert's talking about in robotics, you can start to learn trends. What if you could map out the bleeding profile of patients with certain comorbidities over time? This is data we could never visualize previously because we just couldn't measure bleeding. So now you have like a flight tracker or a growth curve. You can sort of map what's normal. You can start to detect what's abnormal. And then with our friends at Vocera, you can send these alerts to the right person at the right time and synchronize care so that you can spot these anomalies to bleeding and intervene in a more real-time fashion. And that's really what it's all about. It's intervening at the right time, with the right provider, with the right tools, at the right part of the protocol. Is this a stage 1, 2, or 3 hemorrhage? What are the tools and devices I need to intervene as a physician? That's going to be unlocked more and more as you start putting these different technologies together. So we should.
I'm glad, Sid, you're sitting next to Dave. You two can figure that out here, and maybe after we wrap up. So the next question's for Tracy and Dave. Obviously, there's a heightened focus on digital and med tech, and I'd be curious your thoughts, maybe a little bit of the challenge behind that, and where are some of the opportunities as well. So Tracy, maybe if you start, that'd be great.
Okay. So I'll take it a little bit different away from tech for a minute. And I think one of the biggest opportunities in this is around customer experience. And being a customer experience professional for the last 8 years, let me just highlight why that's important for a minute and give some background there. And I do view digital and tech as being major enablers for experience. Just by way of background, we're living in what's called the age of the customer. And Forrester research termed that about 12 plus years ago. And that started in retail, and that's went through every industry. It's now affecting this industry and transitioning into this industry in a major way. And what's happening is people are bringing their experiences, you're doing it as well, from home to work. And it's like, if I can click this at home, why can't I do that at work, right? And you're expecting that from your vendors at work, and you just want brainless transactions, right? And so you want everything the same way at home as you do at work. And we have not been able to solve that or crack that at work. but that is the expectation. It has drastically changed. Experience is now a top purchasing criteria, almost at the same level as the product or service itself. So that is a huge challenge for companies. Now, CX, customer experience, has now evolved into what we call the business of experience. So we have to think about customers, our consumers, our patients, our ecosystem of customers, how we design the product. So a lot of what you were just talking about, Sid. Design the product, the brand experience, our employees, their experience, and the customer. So it's all this integrated. It's all integrated now. It's a huge burden for us. But we're competing against all of those things. It's not just the product. So I share all of that with you because in digital, you cannot separate experience from digital. And so, for example, we can sit up here and create all of these great products for our customers and create great data. And when we go to present it to our customers, if it's hard to digest or it's hard to interpret, it's not a gift for them. It's more work. And so this is where digital, there's a lot of adoption challenges in digital. So again, we can't separate experience from digital, and that has to be part of the experience. And I know, Dave, we were talking about that. So that is my Sermon on the Mount. That has to be a big part of how we start to design and think for our customers in the future. Otherwise, we'll have adoption challenges. But Dave, I'd love your opinion on that. I know you've thought about that a lot.
No, I mean, it's interesting. I mean, Spencer, you asked breakthroughs in digital, and I think that's an interesting sort of concept to think about because, this whole consumerization of IT, I can better track where my food delivery is and how many blocks away and when I'm going to get it than I have any idea about my journey in healthcare right now. And so, the experiences that we get at home on our phones are just completely different than the experience that we have as professionals at work. And unfortunately for healthcare is even further behind in some of those trends and technology spaces than a lot of other industries. But that's the expectation now. The expectation is that the same thing that I can do with my portable devices at home, the same I can pull this up and I have access to any information that I need pretty much anywhere in the world at my fingertips. I mean, all of us here are old enough to remember life before these guys. But my daughter is a freshman getting her nursing degree right now, and she's sort of at that cusp of the age where she's grown up knowing nothing different than having an iPhone and instant access to streaming content, information, connectivity, all of her friends, anyone, all the time. And that's impacting technology in a significant way. And all of us in technology, and again, I'm sort of newer to healthcare, only 3 years in healthcare IT, but we need to remember, especially with technology geeks like me, just because you can do it with technology doesn't necessarily mean you should do it with technology. And it gets back to that experience. And I'm constantly reminded of this as we work with nurses that are out there on the front lines, because they have so much hitting them all day, every day. They're so overwhelmed. They're so burdened. And if we don't get technology right, then technology just makes that even worse for them. And we have to make sure that as we're rolling out newer technologies, that we're doing it not so that they can do one more thing, because they don't need to do one more thing. They're already hugely productive individuals. We need to build technology to take things off of their plates, to make it easier for them to get back to what they are going to school in the first place to do, which is to spend time caring for their patients. And that sort of, consumerization of IT, getting that same level of experience, the same level of easiness. If it works this way on my phone at home, it better work the same way on my phone at work, because that's how my muscle memory is set up to do, and I can't fundamentally have to learn a brand new system. If I can talk to Alexa at home and say, Alexa, add milk to the Safeway list, and it's just that easy to be able to do things with my voice because my hands are cooking or making stuff and I can talk to technology to do that, we need to provide that same voice experience to healthcare, because healthcare is one of those hands-on professions. I'm gloved up, I'm probably masked up, my hands are on a patient, I may be working on a bleed or an operation. I need to be able to have that same voice experience in technology to either get access to information or to tell the computers and systems to do something, or to call, ask for help, other things. I need to be able to do that using just my voice, not my hands, because my hands are busy at the moment.
Yeah, outstanding examples to share, and sort of the challenge of thinking both on the user experience and all this different technology we can lever, which sort of leads into the diverse group that's in this room, that's at this meeting. Tell us a little bit about where collaboration is in this journey. More important than ever, how does it stack up to the 10 years ago in med tech? But some more thoughts on collaboration for the team.
For me.
Any of you?
I would tell you that I think at this point, for us to achieve where we need to achieve, collaboration is a must. And if you think of the differentiation of Stryker, right now, you may not be aware, but we have 85 different types of devices, digital solutions that have the capability to collect patient data, 85. Imagine if those all 85 were connected. Stryker's one of the only companies in the world that can outfit a whole operating room. We can actually have the majority of the back of an ambulance. Think of the data that could be gathered at the site of an event. Think of the hospital beds we have deployed all over. If you were fortunately in a hospital, you might be on a Stryker bed. Imagine if those became digital hubs. And now we look at the whole continuum of care. Continuum of care has a lot to do with a lot of different data and a lot of different data sets. Well, when you have a company like Stryker, there's a differentiator there with that equipment, right? We can execute on digital data and we can collect, but that means multi-divisions. You have to collaborate across a very large company. We talked about agility, talked about the need to move fast, talked about the need to reach. Not necessarily natural collaborators, are we? And transformation is tough. So we formed this entity that I'm proud to be part of called Digital Robotics and Enabling Tech, which actually expands the whole enterprise. So we have 9 different divisions. We have 22 different business units. This is the glue. Everyone doesn't need to come up with product security protocols. Everyone doesn't need to figure out 5G. Everyone doesn't need to figure out connectivity. Everybody needs to figure out BAA and what the format of that should be with an academic institution. So now for us to enable to move fast, to enable collaboration's got to be a winner. There's so much differentiating technologies at Stryker. By themselves, though, they may not come together fast enough. Now we have a vehicle to put it all together, which means we'll get more data across the whole continuum of care, which means we'll be able to collect that data, query that data, data intelligence, clinical insights, artificial intelligence, and those algorithms I created that gets put on software, then further goes back into software upgrades on our equipment that we have deployed around the world. So exciting times. Without collaboration, we won't get there. But Stryker, we're in this position right now to see the future, and we know collaboration is key to success.
How about pushing it just beyond even Stryker? What are the thoughts of collaboration in the marketplace with our customers, with other partners that might have other technology? How important is that now?
I don't think we have a choice. I think the way that the world is changing, technology is changing, customers are changing, competition is changing. If we don't have an ecosystem among ourselves, we can't. I personally know I cannot keep up with those changes. And more than ever in my career, I have to rely on an ecosystem of customers, partners to stay even at the level or a little bit ahead of what is happening in our space. It's just too fast. I don't know what you think, Senator Dave, but you have to.
Totally agree. I make 2 points. The first is going back to UX and UI, and customers having the same digital experience in both areas. We've historically collaborated with companies like Apple because of some of that advance that they bring that's financed by $1 trillion consumer market. I think most folks in this room probably have an iPhone on you right now, and nurses use iPhones in their personal lives. And so we actually went and put our app on an iPhone, and we collaborated with Apple along the way is we got to understand how to better use their ecosystem of software products. And that's not part of what we're doing within Stryker. But the other piece I'd say is, something in Stryker's motto that always stuck with me is together with our customers, we're going to make healthcare better. And I'm seeing that every day now being part of Stryker. We are actually involving so many of our own customers in the design, the development, the thought process of every digital and physical product we build. We get a firsthand view of that. And the Access, by the way, is a small startup guide. It's just awesome because you get so much more access with such a large group. But that focus on the customer that is still being driven within our decentralized model, every business unit has a very, very sort of concerted effort to get feedback and insights from our specific customers. That's a real big feather in each of the reuse caps, and it's a real superpower, I think. So that's a form of collaboration, similar to these outside sort of platform providers. I think it's just collaboration with our own customers that's truly meaningful.
I'll go even one step further from an ecosystem perspective and talk about even collaboration with the competitors. And I know that may be faux pas at times to say, but a little part of me, grew up in the open source world. The open source world of software is all about collaboration, and everyone shares to make everything better, and may the best company win from an execution perspective. But you have to open up and share, because when you open up your APIs to have access into your systems or access into your data, you can have the most innovative people in the world at your company. You're still not going to think of everything. There's still going to be another customer, another partner, somebody else out there that's thinking of some way to innovate on top of what you've built, and it brings everyone up to the next level when the entire ecosystem is working together. And there's no more important place than to make sure that we're sharing that healthcare data than in healthcare. Because if my data is locked in one silo with the EMS and it doesn't get to the emergency room, and that's in a different silo because it's with one vendor, that it doesn't make it to the OR, which is in a different silo than to my recovery because they use a different vendor's information, then shame on the industry for not enabling all of that to connect, because that's the power of helping me as a patient through the journey, is when my data can flow through all the systems so that the care can become better across all of the systems.
And Dave, interestingly enough, regulations and interoperability may force us to go there, like as an industry, right? So it's a great point.
All right. So a real quick question, one that you haven't been prepped for. All this you discussed so far, driving it ahead in an organization like ours, easy, medium, super hard, sort of hard, just you're off the cuff.
The desire is there. The methodology to actually get it done is tough.
Yep.
It's tough.
Tracy?
This is my third go around. I think Stryker is the best company that I've worked for with the best customers.
You have to say that. Yep.
No, I don't have to say that. But I think we just have unbelievable desire and to win. But it's always tough. Like anytime you do any large scale transformation, it's always tough because it's easier to sit here than run. That's always easier for people. People are smart, right? But this is the easiest one for me so far.
Good. Sid?
Yeah, this is a great question because, I'm, as an individual, I'm 9 months into an integration post-acquisition. So I'd say absolutely agree that, the challenges of integration, the challenges of new ways of thinking, that all comes with the territory. These are large organizations. You're going to see this in any organization. One thing that's really unique about Stryker is, and I think it's part of our motto, is how driven everybody is. There has not been one person, I've probably encountered at least a tenth of the 40,000 plus employees in our company. There's not one person that isn't driven when they show up to work. And you see that through the organization. You see that in project teams. You see that at the leadership. And there's some visionary leadership in this company. And I think what's really intriguing is how, there's change agents within this company that are helping drive digital, that are helping drive these new foundational technologies. One of the things Stryker is really incredible, I'm biased here, by the way, so, discounted, is it's got an incredible M&A engine. And M&A has been just a core competency of Stryker, and they execute it like no other that I've seen before. And that is a big part of collaboration and change, is these inorganic moves that the company makes that are very strategic. It's big, but these moves are deliberate, and they are for sure going to happen. So it's a company that you really feel like you're part of a small company. And that's just what one small company got. So,
Dave?
Disruption is hard. It is. I've been part of big companies in the past, and I have a joke that at big companies, sometimes, if you acquire a small company or you're trying to disrupt internally at that big company, the big company has antibodies that will rise up and try to crush you. Just like the human, when there's a foreign object in there, the antibodies rise up to try to destroy it and repel the invaders. But you have to persist. It's hard, but it is absolutely worth it. And that's the thing I love about working in this industry. And I love
vaccine jokes out there, anyone? Right time for that. Keep going.
No, I didn't need to go there. But one of the reasons I love working at Stryker and Vocera, the cultures are so aligned, is that, as Sid said, the focus on the mission and the passion to use technology to help make healthcare better. That's what gets us up every day in the morning, cranking through our days, cranking through our weeks, because as hard as it is so worth it.
Yeah. Super. Well, maybe I'll open it up to the audience if there are any questions. We're happy to take anything. Two comments I'd like to share. One on questions. We always try to make sure our employees all over the world and customers are able to ask questions of us, just to keep a culture where people feel like they can connect and really ask us anything that's going on, and we'll try to give our best insights. The second, as you think about a question to ask, is to recognize the talent. Probably from my chair, what I've seen over the long tenure at Stryker is how we also have to really be intentional about the skills and the capabilities of our employee of tomorrow. And obviously, it's a different talk track than it was, 10 or 15 years ago. And so thinking about that, the specialized talents that we need of how people think, how they interact, this collaboration spirit that's needed, it's so important. And they exemplify this. And we're so excited to have you all at Stryker. So thank you. So are there any questions? You can raise your hand. If we're happy to take any. Maybe you here, and then we'll go up front. Go ahead.
Sure. Howard Loree from Exponent. So my question is, to what extent do you involve human factors in the work you're doing? Obviously, you're trying to transform the way you deliver care, and I'm just curious, how high priority is that? What are the ways you're implementing that?
Yeah, so I'll go ahead and start. We don't write a single line of code until we've talked with doctors and nurses to get the experience right. And so we focus a lot on user-centered design, which is as soon as we maybe observed a problem or heard about a challenge from nurses and doctors, we'll come back immediately with mock-ups. Does this address it? Does this address it? And we'll look through multiple iterations around the design of a particular piece of software or a screen or a voice user interface to make sure that it's solving the problem that the nurses and the doctors are having. Once we get that right, you can do a lot with just mock-ups and just design. Then we'll start writing the code. And then even after we write the code, now test it again, test it again, test it again. It's sort of that human factors process. It has to start at the absolute beginning.
Yeah, makes sense. For our application, it was there was a lot of that just culturally in tech, to be sure, and focus on UI UX is paramount. A lot of iteration. One of the interesting things with our product was we're literally asking nurses in the middle of an OR to hold a bloody sponge up to an iPad and to open it up and to hold it up to the iPad. So just think about that for a second. There's a million things going on. It's tough to do. So what we did is not only worked through that iterative cycle, we had to build in formalized human factors testing as part of our pathway with FDA. And the agency is starting to focus more and more and more on human factors. You're seeing that on a lot of these newer digital health technologies, even during the pandemic, through the EUA process. process. Human factors, with those at-home COVID test kits, really big deal, focusing on human factors. So we standardize and protocolize a lot of that, and it's built into every release cycle. So even if we're pushing a few lines of code, a small bug fix, there's sort of this question: do we does this qualify for a concerted test with, say, 20 nurses to validate the work we've done?
That's a great question.
Human factors is part of actually all now Stryker efforts going forward. In fact, we've created panels of the human factors. In the old days we had physicians coming to one cadaver lab when we were done. Now, on our enabling tech, whether it's software, things like that, workflow matters, efficiency matters, time, shortening the learning curve, what training cycle needs to be, what needs to be included in certification. So let's just take a new robotic software for a new application. We get nurses involved. We've built our simulation labs. We just built one in our new facility in Fort Lauderdale where we monitor behind glass. We have physicians. We have people in central supply that do cleaning of instruments and how to put things back. We're labeling everything. So human factors and then usability is now included in all regulatory filings around the world.
All right, work lord. Now is the time for us to tell folks where to find us on social media.
I'm on LinkedIn. You can find me, Chris Newmarker, just like a Newmarker. Always happy to chat.
And you are both on Twitter and LinkedIn, as am I. I am on Twitter at MedTechTom, on LinkedIn, Tom, Salemi. When you do connect with us, make sure you tag us.
Follow, subscribe.
That's right. Like, follow, subscribe. I was going to ask you to share this podcast episode on those social media channels. But yes, primarily you should like, follow, and or subscribe to the Device Talks.
Doesn't sound as good when I do that. Like, follow, subscribe, share.
You don't have to touch it. You're brilliant. Leave it the way it is. I'll take care of sharing. I'm a sharing individual.
You'll do the sharing.
So if you like, follow, subscribe the Device Talks podcast network, you'll receive this podcast, Stryker Talks podcast. You'll get the Intuitive Talks podcast. We have a new one coming out in a couple of weeks. So you'll get lots of podcasts coming your way. So connect to that. And you can also subscribe to the Medtronic Talks podcast on its own channel. So make sure you don't miss those. We'll have a new episode of the Medtronic Talks podcast coming out next week. So, all right. Great job, Chris Newmarker.
Always good, man. Enjoy the summer.
Thanks to everyone for joining us. Tune in next week. We'll have another great episode of the Device Talks weekly podcast waiting for you.
Woohoo!